Hi, my name is Chadwick Clark. In our ongoing battle against HIV/AIDS, confronting stigma and discrimination remains a significant global challenge. Compounding this challenge is the disproportionate impact on African, Caribbean, and Black ACB communities, stemming from systematic barriers and intersecting social determinants that impede their access to essential health services. As we commemorate Black History Month, the African and Caribbean Council on HIV/AIDS in Ontario, ACHO, is honored to spotlight Black excellence within the scope of HIV advocacy. Today, we are privileged to hear from individuals who have been at the forefront of this critical work. Their insights will shed light on these multifaceted strategies that can be employed to dismantle stigma, drawing from their own experiences, advocacy efforts, and specialized knowledge.
Working in the sector and more importantly, representing an organization that serves ACB communities, you must take into consideration the intersectionality of HIV stigma within ACB communities. We're talking about culture, sexual orientation, socioeconomic status, and gender. These are unique challenges faced by Black communities, and it is important for us to find ways for addressing these multiple layers of discrimination. As a Black gay man who grew up in the Caribbean, I can touch on two things from my personal experience. Homophobia. It is prevalent in the Caribbean, but it's still a major issue here in Canada. I'm talking about hatred and fear of people identifying as LGBTQ. It's erratic, irrational. There is much work to be done to address homophobia on a personal, institutional, and societal level. Something to take and to keep in mind is that this is culturally produced and a learned behavior that should be unlearned. Toxic masculinity. We're talking about teaching boys that they can't express emotion openly, that they have to be tough all the time, and that anything other than that makes them feminine or weak. This creates an unhealthy and unrealistic understanding of what it really means to be a man in today's society. Too often, our men walk around with emotions bottled inside, and eventually, there has to be a release. Very often, this is an explosive way.
I'm here to speak about community involvement when it comes to stigma as it relates to HIV. And I think one of the things that happens for me is that I'm very, very frustrated yet annoyed that we still have so much stigma and misinformation surrounding HIV in our community. I think this is partially due to a lack of education, but more likely for me, the lack of the will of people to learn and understand and change their values or their attitudes.
When I was about 8 or 9, my mother told me, "You're Black, you're female, and you're living with HIV. You have to work triple as times as a normal person does." When I was 14 years old, my father passed away of HIV-related symptoms, and when I was 19 years old, my mother passed away of HIV-related cancer. As a child, I watched adults stigmatize me and were less educated than I was. Now, as a young woman, youngish woman living with HIV, I'm learning so much about life, about love, and about healthcare systems.
When we're doing this work and when we're living our lives, it's important to recognize as folks living in the work that we live to enrich the lives of our community. All we got to do really is just know some key features, should we wish. We're Black. We're HIV positive. Nothing else matters to the outside world and also to our inside and our respective inner circles. The stigma in our communities, yes, better, has gotten better, but, our communities are really what they are.
We have all the tools we need for HIV prevention and treatment in Ontario, but stigma continues to be a large barrier for many communities to realizing the end of the epidemic, particularly in African Caribbean Black communities. And we have to remember that stigma is not an isolated issue. It is part of a deeply rooted systemic factor in our society. And we need policies and advocacy to help address those systemic barriers in order to realize our goal of ending HIV in our lifetime. One of the ways we can do that is through medication access. So, like I said, we have all the tools we need. We have PrEP, pre-exposure prophylaxis, we have HIV treatment, we have PEP. But for many folks, those treatments are not accessible because they come at a cost. If you don't have insurance, if you're not eligible for OHIP, those are things that you have to decide between whether you're going to meet a basic need in your life or whether you're going to pay for these medications. So we need to advocate for policies that include universal healthcare coverage so that drugs come at zero cost to anyone who needs them in the province. Another thing we can do in terms of policies is mandating that healthcare providers undergo a minimum amount of training, right? So things like understanding what anti-racism is, anti-oppression, understanding definitions that impact the daily lives of African Caribbean Black folks that navigate the healthcare system all the time.
In the world we live in today, in as much as over the years, a lot has been done towards the HIV and AIDS response, stigma and discrimination is still very much alarming and has cost a whole lot of people more harm than the HIV itself.
I can remember very early on in my role as executive director here, having a meeting with someone in the community, and at the end of the meeting, walking them to the door and offering them my hand to shake. I remember the way that person froze and paused. They didn't want to shake my hand. That was what the HIV stigma looked like in that moment. Everyone knows that you cannot transmit HIV through a handshake.
During Black History Month, which also holds African Caribbean and Black Canadian HIV/AIDS Awareness Day, we get to acknowledge the profound impact that historical inequalities have had on ACB communities and their vulnerabilities to HIV transmission. The roots of systemic injustices are many and profound, centered many times in anti-Black racism in all of its forms, with all of its negative impacts, including barriers to healthcare. All of these contribute to the ongoing vulnerabilities for HIV transmission within African Caribbean and Black communities. I think that it is only through a deep acknowledgement and fuller understanding of these historical inequalities and inequities and injustices that we as a community can address many of the barriers that exist to ensuring that there is culturally competent and effective HIV treatment, prevention, testing, and connection to care and support for those living with HIV.
HIV can affect anyone. However, the social determinants of health makes some communities more likely to contract HIV. In recent data out of Ontario, it was reported that of all new diagnoses for women, 44% were women from African Caribbean and Black communities. This is very concerning given the size of our population in this province. As a Black woman and as a healthcare leader, it is imperative that we continue to create safe spaces for women, especially from African Caribbean and Black communities, so that we can actually provide competent cultural care and encourage HIV testing. It is my hope that HIV testing becomes more normalized and we can go to our primary care provider and ask them for this test along with all the other tests that we do on an annual basis. That will encourage us to stop the stigma and discrimination and to just have these very candid conversations in our communities.
When I speak about barriers, I am speaking about the stigma and the discrimination that is associated with it. Persons within the ACB community are stigmatized even more within their own community because of their HIV status. We need more community support, we need more solidarity amongst our ACB members. Years ago, HIV was a death sentence. It's not anymore. Stigma and discrimination kills more persons in the ACB community than the virus itself.
We need to take back our time. There's lots of work for us to do. We certainly can't do it alone. And we need allies and co-conspirators to take up the load.
To eradicate or reduce the stigma and discrimination within the community is like through education. So I, sitting down here, encourage each one of us to embark on the fight and the prevention of HIV education within our community and worldwide.
There's so many things that I think that we're behind in socially and culturally, and I really hope that this Black History Month, you really look into Black people aren't a one-size-fits-all. We're not an anomaly. We are a full society of people. They're strong, they're powerful, but we don't always have to be strong. Sometimes we need the help and we need the allies.
I'm just here to tell you that the light will always shine. And after the rain comes the sun. It doesn't matter. You can live happily with the HIV virus. Go for your appointment. Adhere to your medication. Live a healthy life. Eat, travel, do whatever.
In closing, there is an ongoing need for collective unlearning within our community. Many perceptions that we are attached to perpetuates myths that influences the current understanding of the virus. As Black individuals, it is imperative that we take an active role in educating ourselves and challenge the ingrained biases shaped by societal influences. I want to leave you with 3 points. The power of our words can shape attitudes. Let's speak with mindfulness and empathy. 2, we must confront and dispel myths and stereotypes, actively educating those around us. And 3, treating everyone with dignity and respect. It helps to offer support. It is essential in fostering a more inclusive and informed community.